Good morning, everybody. Quick apology. My business casual turned into very casual. My business stuff is somewhere between Providence, Rhode Island, and here. So I was 8 years old when my father had his first heart attack. I was 12 when he had the second, and 20 when he had the third. It was fatal. He was 42 years old. Imagine how I felt when my daughter was 12 and my son was 9 and I had my event. We've come a long way. We had come a long way in 1982. Unlike my father, I had the sweet pleasure of being able to see the faces of the 4 exceptional young people you see in that photo. We're actually celebrating Joni and my 50th wedding anniversary in Times Square last November. She looks a lot younger for some reason. So I have come a long way, thanks to perhaps some of the people in this room because of their innovation, and of course always grateful to the research efforts, advocacy, and programs of the American Heart Association. But if you happen to be the person that's about to have a heart attack in the next 40 seconds, and if you're lucky enough to survive, your dance will have just begun. Clearly, we have come a long way. We just haven't come far enough. Hopefully, days like this will continue to offer inspiring hope, because I must tell you, I do worry which genes these 4 grandchildren of mine have inherited. So it can't come fast enough for me, and the AHA believes that also. So let me share a great example of AHA Inside. The AHA is a leader in developing science-based treatment guidelines known to improve outcomes for heart disease and stroke patients. But getting those guidelines consistently used in patient care has been a challenge. Through the Guideline Transformation and Organization Initiative, the Heart Association is working to accelerate science into practice to provide patients, providers, and systems tools and resources that can be used to better manage care. With support from AstraZeneca, we are first tracking non-STEMI ACS, a type of heart attack that affects over 515,000 Americans each year. Our goal is to prevent recurrent heart attacks by improving the treatment and care of survivors. Research indicates that navigating the road to recovery after a heart attack is challenging for patients, as many don't understand their conditions or necessary life changes, or resulting in low treatment adherence. Consequently, 1 of every 5 heart attack survivors over the age of 45 will have another heart attack within 5 years of their first. Patients need innovative tools that provide actionable information in the critical days and months following hospital discharge. That's why, through the AHA Inside model, the association is developing My Cardiac Coach, a new mobile app that aims to educate and engage patients, empowering their recovery using the association's Connected Heart Health Cardiac Rehab Care Plan, an evidence-based program developed collaboratively with AHA volunteers. The primary objective of My Cardiac Coach is to engage survivors in secondary prevention through engaging contact that will help them learn, achieve, and manage. Through interactive lessons around the Life Simple 7 topics such as high blood pressure, cholesterol, weight, nutrition, blood sugar, smoking cessation, and physical activity, as well as medication adherence, patients can learn about their condition, associated risk factors, and necessary lifestyle changes. The app also personalized goal setting to help patients adopt better self-management skills and healthier lifestyles. Finally, using My Cardiac Coach, patients can manage their condition through tracking their treatment plans and health data. My Cardiac Coach is still being developed. Beta testing will start this fall. The American Heart Association guiding values of meeting people where they are. Technology can help us meet patients where they are, a patient-centered solution. So as I mentioned, beta testing will begin in November, testing my cardiac coach with real patients both in and out of clinical setting. And as I mentioned to you before, it can't happen fast enough for me and my family. Thank you.
Next, we have Dr. Mario Mosconi.